Introducing BLEScath, a medical device brought to you by Bless Biochemicals. BLEScath is a medical device intended for the administration of pulmonary surfactant, such as bovine lipid extract surfactant suspension using the minimally invasive surfactant therapy mist, or less invasive surfactant administration (LESA) technique. The LESA technique is indicated for rescue treatment of spontaneously breathing infants experiencing neonatal respiratory distress syndrome and who meet the oxygenation requirements for surfactant therapy. Neonates should be kept on nasal CPAP or NIPPV for the duration of the procedure. The small diameter of BLEScath allows for the patient to continue breathing spontaneously throughout the procedure. A unique feature of BLEScath is its stainless steel stylet, which holds the desired shape of the catheter as it is inserted into the patient's trachea. It is rigid yet flexible for ease of insertion. The stylet is integrated into BLEScath and does not need to be removed. The design ensures that the stylet will not migrate during surfactant administration. To use BLEScath, measure the length of the catheter to be introduced so that the catheter tip is midway between the vocal cords and the carina. The appropriate depth of insertion, also known as tip to lip distance, should be based on the neonate's weight in kilograms plus 6 centimeters. Use the markings on BLEScath to ensure the catheter is placed correctly to avoid right or left mainstem bronchus insertion. To use BLEScath, bend the catheter into the preferred shape, taking care not to stretch the catheter while bending. Hold firmly with 2 fingers or 3 fingers as demonstrated. Use the laryngoscope to visualize the vocal cords and insert the catheter from the side of the mouth and through the open cords into the trachea. The unlabeled black line markings near the distal end of the catheter should be at or just below the vocal cords. Once BLEScath is inserted, support the catheter at the upper lip with 2 fingers to keep it in place. Keep the neonate's mouth closed for nasal CPAP or NIPPV delivery. Connect the syringe to BLEScath. Ensure there is 0.5 to 1.0 milliliters of air in the syringe, followed by the prescribed surfactant dose, to ensure the entire dose is expelled at the end of the procedure. Begin administering surfactant by synchronizing the microbolus doses with the neonate's spontaneous inspirations. It can take anywhere from 1 to 3 minutes to administer the full dose, based on the patient's spontaneous efforts. If the patient is tachypnic, microbolusing every 2 to 3 breaths is acceptable. Once the surfactant is administered, expel the remaining air in the syringe through BLEScath to empty the syringe. Then, remove BLEScath as the patient continues to breathe spontaneously. After surfactant installation, monitor the patient's oxygen requirements according to the saturation monitor.